All right, class, this is week 2, part 1, venipuncture equipment. So, we're going to talk about the general just supplies. You need to know your supplies, you need to know how to use them, and why we use each thing, right? So, we do typically, if you're working in a small lab, doctor's office, you might have a blood drawing station, has table supplies, special chairs, armrest. Um, Sorry about the PowerPoint here, guys. But it says we have this handheld equipment, things like that, so we can carry it with us. It's most important to know to keep your carts and trays adequately stocked with supplies. It is an important duty. That's where, I tell you guys, make sure you leave it better than you found it, okay? Um, it is your job. There's nothing worse than, like, going and carrying your tray to an emergency and you don't have what you need and it's an emergency. You don't have time to go back to the lab to get your supplies. So make sure you have everything you need, okay? All right. Gloves and glove liners. It's important to know that they are required by the CDC, HICPEC, and OSHA when performing phlebotomy. You have to know that a new pair must be used for each patient and removed when done. You have to wash your hands, hand hygiene before and after you put on each pair of gloves. And a good fit is essential. You do need to know glove liners can be used if gloves cause allergies or dermatitis. That is might be on your certification, as well as barrier hand creams help prevent skin irritation from the gloves. I absolutely do not know how you could put on barrier cream and then use gloves and perform a phlebotomy, but they say you can. Those are just FYIs. You won't see that really in the real world. You'll see that more in the test, okay? That's what they look like. I do not see how you could put on that and then latex gloves over the picture in A and then perform a phlebotomy. And I don't see how you could put on the barrier cream. It's pretty thick and slippery. All right, antiseptics. This prevents sepsis. You need to know the definition of sepsis is microorganisms or their toxins in the blood. We use 70% isopropyl alcohol is the most common for routine blood collection. You need to know this. 70% isopropyl alcohol is most common for routine blood collection, and it is safe on human skin. Antiseptics are different from disinfectants. Disinfectants remove or kill organisms on the surfaces of instruments, and they are not safe on human skin. Hand sanitizers are alcohol-based rinses, gels, and foams. It can replace hand washing if your hands are not visibly soiled. And like I always say, a general rule about every 5 hand gels, you should probably be washing your hands. All right, a personal size bottle of hand sanitizer works. Uh, dispensers. It's best to keep some in your pocket. Decontamination of your hands after glove removal is essential. Any type of glove may contain defects, and some studies suggest that vinyl gloves may not provide an accurate barrier to viruses, okay? All right, gauze pads, cotton balls. That's part of our supplies. We use 2 by 2 inch gauze pads folded into 4 to hold pressure over the site following blood collection. Avoid using cotton balls because they will stick to the skin. What's going to happen is they're going to stick to that clot. When you take it off, those fibers are going to be left behind. It's going to disturb the blood clot. Could make it start bleeding again, as well as those fibers can get in there and be a contributor to infection. I want to stress the importance that when you draw blood, okay, and you get a little drop of blood on that cotton pad, do not get a new one. Just fold it over and don't be wasteful. If it is not soaked thoroughly with blood, you do not need to be throwing it away. And I'll show you when we get in lab what I'm talking about, okay? Bandages, they can be used over the blood collection site once the bleeding has stopped. They can be paper cloth knitted and folded over the gauze. Another phlebotomy supply that you would find is microscope slides, 1 by 3 inches, ink pens, and watches. We have needles and sharps disposable containers and biohazard bags. We will get more into those uses and requirements in our infection. We have more infection control and safety stuff coming, so we'll get more into that in that chapter. I think we talked about vein locating devices the other day in lab. Yes, they're awesome. They illuminate the veins. They're typically used by IV teams, but you really don't see them that much out in the real world, but they are cool. Tourniquet. You need to know it is tied around the patient's arm to restrict blood flow. It should restrict venous blood flow to inflate the veins, but not arterial flow. Why wouldn't we want it to restrict arterial flow? Well, we don't want to cut off our oxygen supply, oxygen-rich blood supply, right? So we do not want it that tight to where it is cutting off arterial blood flow. The most common type are stretchable and disposable. All right, we have our needles. All right, they're sterile, disposable, and designed for single use only. You have different types of needles. You need to know these. Multi-sample. That means that we can take multiple samples of blood with one stick. Hypodermic. That means it goes right underneath the skin. Winged infusion set or butterfly needle. Okay. You need to know the parts. The bevel is that slanted part right there at the tip here. Then you have the shaft. This is called the threaded hub. Okay. And then the rubber sleeve goes over the needle. This is a multi-sample needle because I can pop tubes on and off here and fill different tubes with one stick. Okay. All right, the gauge of the needle is the diameter of the lumen. So that is measuring the internal space of the needle. Okay, diameter is its width across that circle, across the inside of there. Okay, you need to know this. This is so important. You're going to get tested a lot on it. The higher the gauge, the smaller the diameter of the needle. So if I have a 25 gauge needle, it's a tiny needle. And that can be confusing because 25 is a big number. So we think big. It's not, okay? The appropriate range for phlebotomy, so the appropriate gauge or size needle to use for phlebotomy is 20 to 23, with 21 being the most common. Needles are color-coded by their gauge, and we'll go over that in class, okay? All right, we have needles that we use today must have safety features, right? So the different types of safety features that we use are resheathing, which is what you see in the first two pictures. Blunting, there's not a picture of that, and retraction. So those will make more sense when we get into the lab and I can show you them hand. All right, evacuated tube system. Those are the tubes that we use, right? This is the closed system of which blood flows. Well, the whole system is basically the blood flows through the needle that's inserted in the vein and directly into the collection tube. That is the evacuated tube system, or ETS. We often just call our multi-sample needle an ETS needle, okay? You need to know that it prevents exposure to air or outside contaminants. It allows numerous tubes to be collected with a single venipuncture. And you need to know its components. You have the multi-sample needle, the tube holder, and the evacuated tubes. Multi-sample needles, they, again, how many times do we have to say it? They allow multiple tubes to be collected in a single venipuncture. So it must be important. We're talking about it a lot. They're double pointed and have a threaded part that screws into the tube holder. The tube end of the needle has a retractable sleeve to prevent leakage. That's that rubber sleeve, okay? It's available with and without safety features, and if there's no safety feature, it must be used with a safety holder. All of the ones that I know that are used in hospitals and healthcare facilities today have safety features, okay? Tube holders, they can come with and without safety features. And if it does not have a safety feature, it must be used with a safety needle. And again, I can explain this a little bit better whenever we are in the lab looking at the different types of needles. It'll make more sense, okay? All right, evacuated tubes. They are used with both the ETS and syringe method. They're available in different sizes and volumes. We choose the size based off, and you need to know this. We choose the size based off the age of the patient, the volume of blood we need for the test. So how much blood do we need? The size and condition of a patient's vein. All right. These tubes can be available in glass or plastic, although plastic is preferred. OSHA requires that the tube holder with the needle attached must be disposed of as a unit and never removed from the needle and reused. Okay, and we'll look at that when we're done with the ETS system. We throw the whole thing away. We don't reuse the needle. That used to be done. We used to reuse the holder, not the needle. All right, these tubes, they have a vacuum that creates that pulling of blood into the tube. So if there's 10 mil tube, that tube is going to fill with blood up to 10 mils automatically. You're not going to have to do anything, okay? Additives are a substance added to the tube, right? A non-additive is no substance added to the tube. We know what is inside that tube based on the stopper or the rubber part that caps the tube, and it's color-coded, and that color coding across the board is going to tell you what additive is inside that tube. And we are going to get deep into that. We have to know those pretty good, okay? All right, here's an example right here of the tubes. This is what they look like. They come in all shapes, sizes, manufacturers, but the colors pretty much stay close across the board, no matter where you work or manufacture, okay? And I'm not going to get into all of those right now. We do have a whole PowerPoint on what's in the tubes, okay? Our syringe system, it's an alternative for patients with smaller, difficult veins. It consists of a barrel and a plunger. And then once we draw blood with the syringe system, you must have a syringe transfer device. It allows for the safe transfer of blood into the tubes without using a syringe needle or removing the tube stopper. It is the safest way to transfer blood into tubes. All right. This is just an example of a syringe system that has a safety needle attached to it already. All right, our winged infusion set, or another name for the butterfly needle. It's effective for small and difficult veins on the hands for elderly patients and pediatric patients. It allows more flexibility and precision than a needle and syringe. You need to know the system contains a needle, a tube, a lower attachment, and then the little wings that we see, okay? This is just another. All right, this is another example of a blood collection system. You really don't see this very much, but I wanted you to take a look. All right. If you have any questions, just write them down, shoot me a text, or we'll talk about it in class. Have a good day.